Action!
Okay. Go to the Rolodex. Look up your patient. Okay, I have a specific patient. Okay. Highlight it. Go to electronic health record. If you want to practice this on that day, you can go ahead and go treatment plan, add, click on new item. I'm doing a periodic oral mouth and review for a dental exam. And let's say, yeah, that's all we got. Okay, just enter something in there for our purpose of the training. Verbalize, Professor, say it's me, Professor Velker, could you come over here and improve my treatment before I go get my patient? Okay, you do that. Okay, Professor Velker, is it okay for me to go get my patient now? Go get my patient. Bring them back, talk to them, get them seated, make sure you have eye contact with them, have the computer where you need it. Go to electronic patient record back there, click on forms. There you go. Start check. Well, we're not disappointed. Get your start check form on, okay? Let's see, we go through after review of patient's medical history, medication list, summary. If they're a patient of record, we would normally put anything that's significant here. Let's say this is a brand new patient, you don't know nothing about them. Leave it blank. Anything in pink is what?
Incomplete.
It's bad, it needs to be filled out. So, student summary, significant medical history, not known due to new patient. Say the blood pressure was 120 over 80, it's normal. Pulse 60. We don't know if they need a pre-med because they're new. If they do, that's where you would list the type of pre-medication name, because it depends. If the person is allergic to penicillin, it's probably going to be clindamycin. You need to list out the dose and when they took it. Normally with pre-med, it needs to be taken an hour before the appointment. So it's always good, okay, what medication did you take as your pre-med? Ask them. Instead of, don't ask them, did you take penicillin? Ask them, or amoxicillin, what did you take for your pre-med? Hopefully they'll say they took their amoxicillin. How many did you take? What's your dose? That way you're verifying that they took it. What time did you take it? Put in the reason. It may have been amoxicillin, 4 tabs, 500 milligrams. Okay? And anytime you fill something out, it's going to put the current date at the point. Reason for the pre-med, I guess it's under the same thing. Joint replacement. Last 4 months. You know. You do not have to weigh them or measure their height or take their temperature. They're a new patient, you don't know it. If they do have an INR, you place that information in their blood glucose and see it's not 20. If it's over 200, it's high.
Will they know if they have an INR?
Most people do.
Okay.
Unless they're new to it, but they should. Most people know the RegNat stuff, and you can even ask them over the phone if they have a current when their last blood, because they usually get that blood test off. Just If there's other lab results, say you have a patient who is HIV, immune suppressed, there'd be a CD4 count in there. I have no clue what tooth validated means. I guess you're trying to validate the teeth. I don't know what that means. That is new to me. Unless they're trying to validate they have teeth. I don't know. I have to ask
Do you
that
have
question.
teeth? Do you need to get your teeth cleaned today?
Do you have teeth? How many do you have? Or are you edentulous? We do have people that are edentulous that just come once a year just to get their mouth checked out and look at their appliance. So even people who don't have any teeth need to have that because it's like a screening and to check out their appliance, make sure it's fitting correctly and all that stuff. Noting additional comments about the patient that's relative. And then whoever your professor is for that team, who's checking you in for the start check needs to go here. Because I'm your professor. So whoever's doing the multi-personality day is who the professor is going to be. Okay?
So do you let the professor type their name in, or do you do it for them?
You type it in. So all you have to do is be ready for them to come over, for you to review this part and go to the next. So once you have all this filled out, you're going to review what you have on Start Check with your faculty member. No, let me out of that. Okay, normally there's a little red area over your name here so you can start check. But since there's no appointments in here associated with anybody, with the clown, it's not going to do it. Because when you do this section, there should be, when you click on it, it should say start check. It comes up and it has appointments. So whatever your appointment for, you move it over to that what you're doing that day. You'll see it when you reserve. Let them show you that. And there's a button. There's 3 buttons. There's a button to print, there's a button to preview, and there's a button just to get a preview. Do the preview so you have that up so it gives you all this information without you having to scroll. And then report to your faculty, but you don't have to do it for medical history today or for PE because clown won't let you. I was just letting you have that information when it comes. Once you get approval from your faculty, then you can go and go to forms, go to medical history, pull that up. Okay. Have you had, or do you currently have any of the following conditions? Mr. Jones, have you had a heart attack? Ever had a heart attack? And say yes. So yes, I have had. When was the last heart attack? 5.5 months ago. No, one within the last 6 weeks.
Tell her I'll be right back to do her film.
How many heart attacks have you had in your lifetime? And the last one was 5.5 months? Normally, you run out of room here, write some stuff in a Word document. I can't find Word. Find Word. Two thousand. So you write some information over here. You can doctor it up before you get your faculty over here, but you're just trying to get it. You may not get it all here, but I'm putting something permanent there. 5.5 months ago. Okay. Were you hospitalized? Were you hospitalized both times?
Not yet. She can't crawl yet.
Any specific treatment? So these are the kind of questions you ask. Okay?
I was like, I don't know what to say.
Have you ever had a heart transplant? Have you had any infection up to your heart? Any valves that have been infected or anything like that? That's where I get the infective endocarditis. So I just ask if they've had any infections to their valves instead of saying that because they were like, what?
Right.
Have you had any valves in your heart replaced? Were you diagnosed with any defects at birth or anything like that? Have the doctor ever told you about any irregular heartbeats or does your heart race or anything?
It races every week.
When does that happen?
When I get anxious or
That's where you can specify. Have you ever been diagnosed with having chest pains where you have to take anything for it when you do have chest pains? That would be the angina. Has anyone told you that you have congestive heart failure where your heart blood pump blood like or any kind of artery disease? Have you had any type of replacements in your heart or veins, stents?
I did have a stent.
When did that occur?
5.5 months ago, my second one.
And if you're not familiar with that, that's when you look at things and you may have follow-up questions. So, anyway. Have you ever had a pacemaker replaced? If they have, you might want to ask when it was placed, what type it is, if it's shielded or unshielded. If it's unshielded, certain devices will affect it, like an ultrasonic.
Oh, really? Wow.
Have you had any surgeries where they had to go in and open your heart? Any other heart issues? Do you have any history or been diagnosed with high blood pressure? Are you currently under care for your blood pressure?
Yes.
And when was your last visit?
Do you really have high blood pressure? Oh, okay. I thought so, but then you're just like you were just acting like you were trying. Oh.
And of course, if I took vitals, which I had 160, 120 over 60, 80 or whatever, is the patient's blood pressure elevated or under control? It wasn't elevated today, so you can always ask them, how is your blood pressure readings? How was your reading at your last visit?
It was controlled.
What was the current blood pressure? Do you take medications for this? That's fine. You can always contact the pharmacy.
Do we ask for their pharmacy?
You can ask, do you mind if I contact your pharmacy, or if they have a cell phone and call them?
Okay.
Pharmacy has a list, as long as they go to the same pharmacy.
That probably doesn't happen, but
Most of the time it does, but those people who are after just pain medication, skip it.
Yeah.
Have you ever had a stroke? Do you have any bleeding disorder, thinning of blood? Do you have any sleep issues or problems? Ever been told that you had sleep apnea? You wake up in the middle. Have you ever felt like you woke up in the middle of the night and you're having a hard time gasping for air or something? Lost breath?
so what if you said yes?
Said yes. If yes, list one diagnosed and what the treatment is. Some people have a CPAP machine for sleep apnea that they have to wear. And that can dry out those oral tissues too, and something to look for. And when you start learning about caries risk, you know what the effects a dry mouth has on it. Okay? No. Have you ever been diagnosed with asthma, or you have? I'll go ahead and ask the rest. COPD, where you have to have an oxygen tank, or
No COPD.
just asthma. So it is asthma. So you can check that. How often does that occur?
Usually seasonal. Winter is the hardest month.
Oops, sorry. You're fine. Take Jeff.
Winter is the month.
Yeah. Underground had so smells bad. They were in the spring.
When was your last occurrence?
Last Christmas. I don't know.
What did you do? What do you do when you have difficulty?
I just use my inhaler and it usually calms me down.
When were you diagnosed with asthma?
I was 5 years old, so 17.
What year? 2009?
No,
I can't hear.
2099.
I hope I can hear on this.
2009?
Just gonna get all up your business, okay? Do you mind?
That's fine.
Okay. You want the computer? I guess. Oh. Oh yeah, that's great. Hopefully I don't drop this on your head. Sorry.
So I really think this. Oh yeah. Yeah, it's on this phone. Yeah. Because that's what we need to like check. Start check and then that's what we're actually. Yeah, so we're doing everything out of order. I mean, we knew the phones.
Like I say, doctor up later. When were you diagnosed with high blood pressure?
June 2014.
Any other lung problems? Have you been ever told that you're diabetic? Do you have low blood sugar, or do you have any thyroid issues?
What do you mean by thyroid?
Some people have something called hyperthyroidism, which means they are stimulated too much, and hypo means they don't have enough hormone for that, and they have to take a supplement or something. So, and then there's Hashimoto's, thyroiditis, yeah. But you can go either way. Endocrine. What do you think are other endocrine stuff? Remember endocrine system?
Yeah, well, like insulin.
Yes. That's diabetes.
Maybe weight gain. I mean, are there any like ways or anything that could reverse control? Maybe because then endocrine system.
That's digestive tract.
Maybe like an obese.
Let's see if what goes under yes. See if they got anything. It says specify. Endocrine system. Some people may have problems with their parathyroid. So you gotta think about that. Pituitary gland, stuff like that. So look up your endocrine system and review that from physiology so you can formulate questions. Digestive tract, let's see. Do you have acid reflux? So acid, what, do you take medication for it? Prilosec. I'm like here going for Prilosec. I keep talking about this. I'm good, but not that good.
I think that's worse.
There's Nexium, Prilosec, and then there's the generic Prilosec.
I am not.
Does anybody, you don't happen to have any ulcers or irritable bowel syndrome? You ever seen those commercials? Gotta go, gotta go, gotta go. Yeah. Irritation of your colon. Ever been diagnosed with Crohn's disease? Which has to do with more of a gluten-free diet.
When you say stuff,
Here. When were you diagnosed with acid reflux?
2012.
I'll just put the medications in and I'll follow up later with specifics. Okay. Have you ever been diagnosed with a liver disease? Have you ever had any kidney or bladder issues? Have you had any broken bones or torn muscles or muscle weakness or leukemia or something like that that may affect you? Click the wrong button. Are you currently taking any calcium supplements? Such as Boniva or... Okay. I'm going to talk to you a little bit right now. This is oral bisphosphonates. It can come in IV form and tablet form. Tablet form is more like Boniva that you may have seen a commercial on. Normally, what you're looking for, you're more concerned about people on IV. Oral, you can have a manifestation of necrosis of the jaw. So if anybody ever is complaining about jaw pain or anything that may have been on an oral bisphosphonate, you should take a Pano just to see what's going on in order for the dentist to look at it.
And they can have that with IV as well.
IV as well. IV, I would do a medical consult before doing anything. Oral bisphosphonate if they start complaining about it. And people on oral bisphosphonates like Boniva and stuff should only be on it for 5 years. Okay? So if someone tells you they've been on it for 10 years, medical consult. Okay? And I'll just see what it says with yes. So if you click yes, it's going to say oral IV and name of agent type. Is it oral or IV? You put oral. Most people are on oral. I don't usually see that many, but you never know. What is their regimen? Usually with Boniva, it's 1 tablet a month.
Oh wow.
And it disperses throughout the month. That's how heavy dose it is. This thing, Boniva until they went in generic form was like almost $600 for 1 pill. My poor mother. So.
600 a month.
People have to get like grants and stuff for medication.
Like a rent.
Yeah. Medication's not cheap. It's sort of like the EpiPen thing going on right now. It's, when was the last dosage? You can say September 1st. Because the month's just starting. Okay. Have you ever had a history of osteonecrosis? You don't ask them that. Ask them, have you had any disease of your jaw or anything like that? Because osteonecrosis, they don't know what that means.
I have some necrosis. It's like death or dying.
Dying of the jaw. Yeah, it's eating away your jaw. So, no, or you can leave it unanswered if they don't know any history. Have you ever had problems healing from a dental treatment? Say, they got a tooth extracted or they've had pain and stuff for months or weeks. They haven't. That's what we're trying to look at. That should be a red flag. Let's do a Pano. Pano will show the whole thing. If you ever had a Pano done, it goes around your head. So, okay. And it will ask you some more questions pop up too. You know, these questions I didn't answer. Just gonna happen. I'm going real right here. No. Okay. See, pink stays up there unless you answer it. So, in terms of eye, ear, nose, and throat problems, if they're wearing glasses, obviously, you can write that down. They're wearing glasses. You won't know necessarily if they're wearing contacts. You're in your living room. You do that because that'll creep them out. Have you ever had cataract surgery or glaucoma, or do you wear contacts? Have you had any kind of eye surgery? LASIK is another eye surgery. Okay. So, don't forget about that. I had LASIK last year.
Is it working good for you?
Oh, yeah.
I was saying my boyfriend wants to get it.
Yeah.
But his eyes are getting worse still.
I got it, and I'm in my 40s, early 40s, so they did monovision on me, so I don't have to have the bifocals as soon as I leave, which is good because my eyes did adjust. So I can read fine, no problem. But when you hit your 40s, they encourage you to do monovision. And my husband wanted it, but he didn't qualify for LASIK. His eyes are too good, and he's like a software engineer. He looks like a pewter all the time. I'm like, what is wrong with this kid? Have you had any issues with your ears or chronic infections or any history of chronic ear infections when you were younger or any hearing issues?
Keep it lively, guys.
Yeah. Any issues about your nose? Do you have sinus infections?
I still do.
You have sinus infections?
Yes.
That was like me last week.
I've had it for 2 weeks.
Do you take medication when you have a sinus infection?
Sudafed.
Just plain Sudafed?
Yeah. 12 hours Sudafed, 1 tablet. You know it. I'm on it right now.
Okay. I'm just gonna put medication. All right. Medication. When was your last sinus infection?
They